Hi, I'm Dr. Weingarten. I'm here with Dr. Panico. She is the chief of rheumatology at Summit Rheumatology in Arizona, Colorado, and Oklahoma. We were going to talk about the interaction or the overlap between autoimmune illness and mental health. I wanted to start with a super general question as to not lead us anywhere. What do you see as the interaction between the two?
So I think there's a big interaction. I think when we look at the human body as a whole and look at the person for the complaints and the things that they're coming in asking for help, the interaction, I mean, it's leaps and bounds. And I think we're understanding that now compared to even, 10, 15 years ago. A lot of our medications that we use in rheumatology affect the nervous system and affect cognitive thinking and the way that our, brain and nervous system interact. And I think our diseases interact that as well. Chronic inflammation affects the way, our brain and nervous system act. And so the more and more we learn and understand that, I think the better equipped we're going to be at addressing the human body as a whole. I can go on, some recent examples. We just had in rheumatology a device, a vagus nerve stimulator, approved for the treatment of difficult to treat or refractory rheumatoid arthritis. And that just goes to show the connection between the brain, right, and the vagus nerve and inflammation and the way that our body heals and adapts to signaling. So I think, I mean, we're getting there definitely, and interactions like this, right, help us understand. So yeah, let's dive in. I know there's lots of stuff you want to go over.
Yeah. Yeah. And, kind of following that, I put together a flow chart. I'd love to hear your feedback or any points that are particularly important to highlight. So I'll share that screen.
Yeah, absolutely. I mean, the this flow chart just shows, right, the complexity and the integration of the nervous system and brain neurotransmitters and chemical signaling, right? Cytokines are listed on that chart kind of in the middle there, and that's in rheumatology what a lot of our medications and even our diseases are targeting is cytokine release and production and what our body does with those chemical signals, and how that relates then back into, neurotransmitters, right? A lot of what we deal with as humans is serotonin and dopamine and, the foundation, things like that. And so it's all a big feedback. Your arrows point in all different directions, but I think it all, again, is like a continuous cycle. And when you have a hiccup in one of those areas or one is slower than what would be considered balance, I don't like to say normal because in neurobiology, right? Like, what does that even mean? But when we think about the balance of the body, where is that balance going to settle to where we feel physically and mentally feel like we're living a life that we want to be living versus where we're not necessarily in regulation and things could potentially change. As sort of angled as your diagram is, I also think it's very circular, like cyclical too. It just feeds back onto each other, onto itself, right? And the hormone loops and the hormone cycles and all that stuff again are very cyclic, and all these mechanisms feed back onto themselves. So yeah, I think this is spot on.
In psychology, we talk about the HPA axis and how the cortisol can dysregulate uh, our central nervous system ability to regulate stress in the future. So it sort of results in this sort of snowball or cyclical thing where the longer it's dysregulated, the more dysregulated it becomes. Uh, and that makes me wonder about the risk of missing this diagnosis, missing this process, that it kind of snowballs, if I'm understanding correctly. That's at some point we have to say something needs to change in order to stop the cycle. And how do we catch that, address it?
Yes, cortisol really is at the foundation of a lot of our sort of neurobiology, and it can even alter the way our DNA is expressed in certain types of cells. So, our immune system, for example, when our cortisol levels are high during periods of either physical stress, emotional or mental stress, a period where your body is literally being stressed, whether that's from hunger, malnutrition, or an injury, right? Something where you're not able to kind of compensate through, those cortisol levels shoot up and then they have the ability to stay high. In states of stress, they remain high. And that in turn affects hormone expression and production. That affects how our immune system responds to just basic everyday germs that it comes into contact with. So it's really common for people to say, I feel like I'm always sick, or when I get really tired and fatigued and worn down, I get sick easier. And that's absolutely true. Our immune system can't do its job to its highest capacity when those cortisol levels are high. And typically, we're able to regulate. Again, it's all based on regulation. If your cortisol level shoots up because you're late for a meeting, right? You go to the meeting, you get through the meeting, you realize, okay, I'm not getting fired. My cortisol level starts to come down. But we live in this state of just constant something stresses us, and then something stresses us, and then something
Hmm.
stresses
Hmm.
us, and then we go home and something is even more stressful. So our cortisol, it's like a ladder. Every rung elevates something in the negative feedback loop that can change, again, DNA expression that you might not see for years. It's kind of like we believe skin cancer really develops from something that happened, maybe during your teens or 20s, and then those cells slowly change over time. And the same with neurotransmitters and the way that our immune system is affected. The episode that you may be feeling today or yesterday or now, right, in the present moment, might be a reflection from something that happened in childhood, or it could be a reflection of something that's just been kind of compounding for a while. And then something pushed it over the edge. And then here you go with symptoms that then lead to a diagnosis. And I think, kind of going back to the idea of like Gerber Mate, somebody who talks a lot about like what the body remembers and how our
Hmm.
body and our nervous system have a memory that's isolated from our cognitive thinking, right? We tend to not remember certain types of things as a defense mechanism, but our body remembers the whole thing. And so when we think back about that mechanism, it's not so much things that you're able to change in the moment, although that definitely makes a difference, things like your diet and exercise and sleep. But the start of it all is in the past. And that's, I think, what is really important to recognize this intersection, right? Is like, where
Hmm.
in this loop can I take the power and change one thing at a time? Where can I change the way I'm responding to life and the stressors and the things that are happening around me, my environment, and reset, right? We talk about kind of recalibrating. At what point do you as a person have the ability to change your cell's destiny?
Hmm.
And I think that's really like powerful when we can realize, we see sleep on this map, right? Okay, so for 3 years, I've been having difficulty sleeping because I had a baby. And we're just now getting kind of out of the phase where that toddler is requiring so much attention. And so you may start to notice, okay, I can sleep a little bit better because I'm not in that sort of new parent worry phase, or I'm not being woken up constantly. Or people, will say, I have a stressful job and it's really hard. I lay awake at night with a lot of anxiety and thinking about all, ruminating on all the things. That's going to translate then to affect months down the line.
Hmm. Yeah, I mean, the things you're saying make me think about, for example, people surviving the Holocaust, their offspring have a greater risk of PTSD. It's
Yes,
in our bodies, it's epigenetic.
generational
Yeah.
trauma.
Yeah. And people who have PTSD have a greater uh, tendency to have autoimmune illness. So this interaction is pretty concrete. So, and that does open the question, what do we do? And I think I'd like to explore that question both on individual levels, but also in terms of our healthcare system. If you had sort of like an elevator, pitch for a PCP or a psychologist or other professionals, are there things they could do to recognize this to um, help their patients who might be struggling with whether it's autoimmune diseases explicitly or sort of this more subtle syndrome of some autoimmune dysfunction? Are there things you wish other professionals would know and say to their clients, patients?
I think yes. And I think, again, the more awareness and the more we're talking about these things interacting with each other and with every single specialty is important, right? Because it's hard to rely on just one person to fix the whole body. And I think the biggest thing for me is just acknowledging it and respecting each individual person's story. Because, like you mentioned, right, something that didn't directly happen to me, but happened to a family member or happened generations ago, that's deeply rooted in your DNA. And those experiences are transmitted through behaviors, right, and stories and family interactions that may not be explicitly written down or verbally said, but it's known about. And I think a lot of that, just acknowledging, if we meet somebody who's struggling through identifying a diagnosis or having complaints or talking about PTSD, recognizing this is not something that's fixable right now. This is a process. It took a
Hmm.
while to
Yeah.
get here. It took something traumatic to bring you here. And it's going to take some work to release that and to get through this. But we have such a stigma that these things are bad. And rather than naming it good, bad, neutral, it just is, it's a fact of life. It is what it is. And we can't really make it the person's fault, the patient or the
Hmm.
client's fault. But we can help them learn skills and coping mechanisms and ways to empower their own selves to recognize, okay, these are the things that make life a little bit more challenging for me to deal with, whether that's stress, whether that's angry, a temper, whether that's the way that we cope with food or gambling or how whatever the coping mechanism is for dealing with that stressor, right? So I guess in a nutshell is just normalizing something that humans experience and not necessarily labeling it as good or bad, but rather recognizing I'm a healthcare professional and I have tools that can help you through this. And
Hmm.
recognizing that not every tool works for every person, right? There's a reason that AA is successful, but there's also a reason that people don't use AA, right? And so I think we have to recognize, okay, if my tactic today didn't sink in and doesn't work, then I'm going to see the client or the patient back and revisit, okay, well, what was the barrier that made this challenging? Right? When we think about quitting smoking, for example, like why is it so challenging for people to do that? And help support with the tools to say, I recognize this is a difficult thing, but let's take one step at a time. Let's target one thing on this chart that you drew, right? And let's address that each visit. And then when you come back in 6 months, we've talked about six things rather than saying, this is very complex. I'm going to send you to three other specialists who are going to answer
Hmm.
these
Hmm.
questions, and
Hmm.
I'll see you back in a year. That's not helpful to anyone. That's not helpful to the medical system. That's not helpful to the person who's in front of you asking to feel better.
Yeah, yeah. I like the point about lifestyle change and identifying maybe that one low-hanging branch for that person, maybe that what's causing some inflammation or stress, and starting there. And if we can make a 5% difference, they're going to be ready to make another one. They're going to have a little more energy, a little bit. But I see a lot of clients where it's like, okay, this isn't just PTSD, or this isn't just depression. There's something else happening here, and they usually have a long story of like, I saw some doctors. It's expensive for me to have this copay, and maybe these symptoms uh, of the autoimmune effects of stress. It can be so diffuse. Like it could be GI, physical pain, sleep. And I think a lot of times people have the experience of a symptom being treated, and then there's side effects, and maybe it doesn't adjust the whole picture, and they burn out. They stop going to doctors. Sometimes they get the sort of like benign neglect of like, let's check in on this because like it's not necessarily clear what's happening in that like 20 minutes that we have allotted with for an appointment. um, so uh, I like the idea of being attentive to it and considering this process of picking that maybe low hanging fruit, and over 6 months you can address six things. Are there things that individuals should be doing if they're like, yeah, there's something happening here. Like I'm exhausted, I have physical pain, I have GI symptoms, and none of these are getting treated with like a specific targeted medication for that thing.
Yeah, I think really just sitting in awareness of what your body is feeling and trying to communicate to you. So I have patients come in all the time with joint pain. That's one of my biggest complaints that I see in rheumatology is what brings people in is like body pain or joint pain or muscle pain. And oftentimes my questions are a little bit, sometimes we both can get a little frustrated because it's like, I really get to, when you do this, does it hurt? Tell me what makes it better or worse. Tell me when you feel it like this. Tell me like all these little details of when is it that your brain is really preoccupied with hurting, and to try to narrow down what what they're really trying to say. We have words that we use for very basic things, right? Like abdominal pain. But what does that really mean? Does that mean I ate something last night that didn't agree with me and I don't feel good versus I have this pain every single day of my life and I have anxiety and I'm nervous about something, right? I show up to work and I just am like a ball of nerves because I don't love my job. Like we have to really kind of take it back a step and just dissect when I don't feel good, when the voice in my head is telling me I don't feel good, or I'm tired, or I'm in pain. What is happening? What is
Mhm,
that
mhm,
voice trying to express to you as a person? Because it's really easy to get in this cycle of, I don't feel good. I don't feel good. I wake up, I don't feel good. I'm tired. I'm tired. I do something and it's worse and I'm tired all the time. And that voice just cycles all day long, right? Instead of the voice that says, oh, this event where I had to present in front of 15 people was really intense for me. And now I just need to like recover and recoup a little bit. But I'm not necessarily like ill because of it, potentially, right? And so, like, what is it that's happening in the moment when you feel like that voice is really loud? And recognizing, okay, am I getting the basic human necessities? I think it really comes down to like assessing, almost like I kind of go back to the toddler analogy, right? If you're raising a child, do they have clothes? Are their clothes clean? Are they
mhm,
getting
mhm,
sleep?
mhm.
Are they actually getting good sleep? Are
Mhm.
they eating nutritious food, or are they eating snacky stuff that you're kind of grab and go, like, I'm doing the best I can? Because our body needs nutrients to function and our brain needs good nutrients to actually process everything that we're being thrown at all day. So the basic, human necessities, right? Calories, carbohydrates, protein, fat. Are you getting sleep, or are you waking up 3 times at night because of something, or going to the bathroom, or letting out your puppy, right? Like, what is it that's keeping you from being able to sleep?
Mhm.
And then during the day, what's happening, right? Are you constantly on edge because of something? Are you in danger, literally, like you're in a situation where you're afraid that you're in danger? Or
Right.
are you telling yourself that you're unhappy because you'd rather be doing something else? I think a lot of us have this idea like, life is better if I were doing this. Like sometimes I have those days where I'm like, I just wish I was the person that walked around my neighborhood at 10 a.m., who had the liberty to do that.
Yep.
But the reality is, on a weekend, I'm not the one walking around at 10 a.m. I'm doing other things. So, like, that isn't, even though that looks like something I want, it's not really a choice I make, even when I have the opportunity to do that. So, we have the tendency to, like, really get into these sort of mindsets where we tell ourselves things need to be different, but what needs to be different, right? Like, what is it that you want to change? And is that changeable? And that's kind of where we go down to like one thing at a time, right? Like, if I have the power today to make one decision, am I going to decide to eat something fried that I know gives me indigestion? Or am I going to pick a salad where I have like more than one nutrient group? And
Mhm.
if you make one decision to change into something that's beneficial, then you see that that wasn't bad and wasn't as hard. And then you go on to make another decision. Am I going to stay at work super late tonight and get home really stressed and tired? Or am I going to cut myself off from my email and say, I'll finish it tomorrow and go home and spend time with my family? You have the power to make those small decisions, even though we think we don't have that control. We actually do.
Yeah, I mean it's wise, right? This breaks down into sort of three categories: lifestyle change, nutrition, stress management. And if we can, again, that 5% difference, think about, do I feel a little bit different, a few days a week after making this change? And we get this buy-in, we're like, yeah, this is worth it. Let's do another one. Um, but it can be so easy to slip into feeling hopeless or helpless about that change if we haven't identified the right one for us as an individual. Tried it. Sometimes we fail. We pivot, try something else. But that's a process, and I like that this is the points you're making. They're doable. They're not like you have to. The only way to fix this is going to see the number one expert and getting on some fancy medication that your insurance might not cover. Right? These are things that every individual can do. That my experience is with my stress management. If I'm not taking care of it, it snowballs. Right? If I do a little bit every day, you know, worst case scenario, I can tread water. Right? So it's kind of how do we keep check of ourselves and keep an eye on it and take care.
And I think recognizing when you're treading water, right? Like we all get into these sort of survival mode phases of life where we're like, this is the best I can do right now. But then recognizing, okay, well, what is something I can take off my plate that will make me move a little bit closer to where I can touch the bottom, right? And whether
Mm-hmm.
that's asking a friend for a little bit of help or not being so much. I think a lot of us struggle with like perfectionist qualities. We want things to be so perfect and so much in line that the image of it all is so overwhelming versus just executing the thing, right? Like I kind of think about silly little things. Like, do you really have to separate your grays and your whites when you do laundry, or could you just combine them together and use cold water?
Mm-hmm.
There's little coping mechanisms that, again, it all adds up over time where you're kind of like, okay, nothing bad happened when I did that, right? I didn't put anything red in there and nothing is pink, but it's something so simple. I think sometimes we're taught to that things have to be done a certain way. We're taught that we have to execute to the highest quality or it's not good enough. We're not worthy of praise or love if I don't meet somebody else's expectation. And that expectation might not be there in all truthfulness, or it might be there and we can kind of scaled back the intensity of it. I think one of my favorite things right now is Mel Robbins' Let Them theory. And she really goes into detail about we can't control how other people react. That's
Mm-hmm.
on them, but we control ourselves. So if somebody says something that's triggering to me, I can say, that was them. And I can turn around and take a deep breath and not engage. But if I interact and engage, what happens to my stress level? It shoots way up. So if you're doing that multiple times a day, potentially with the same person, even, right, and they're not
Mm-hmm. Mm-hmm.
meeting you with your side of the story, you're kind of banging your head up against a brick wall in a way. Like, who's who's responsible for the way you interact? That is only you. And I think once we realize that we can't control other people and we allow them to be them and take the responsibility for us to be ourselves, it takes a lot of pressure off to be the image of something, right? I think when we realize, I'm okay if I don't make my bed 7 days a week. Like the house didn't burn down because of that.
Mm-hmm. Mm-hmm.
So if that's something that stresses you out every day, try not doing it and see if you feel a little bit less stress. If it stresses you to not do it, why does it stress you out so much? I think
Yeah.
there's just this idea that we have to live life a certain way. And who's keeping score of all of that? There's no scoreboard, but it's
Well,
our health, right? It's our
yeah, that's
anxiety and
this. Yeah,
our health.
our body keeps score. Yeah. And one of the things I sometimes talk with my clients about who clearly has something medical going on that's affecting their anxiety is our brain labels it. But is the label our brain puts on it accurate, or is it just our body? If we already have this haywire system, if we can say, wait a minute, I'm saying that my bed not being made is a problem, or I'm saying that this person has to agree with me, that's a thought, and that might be a sort of arbitrary label that our brain, it's its job to put thoughts on things. But maybe the reason I'm feeling so worked up about this is because my physiology is haywire. And if I can label it as there's something physical and not kind of jump to that conclusion, okay, I just need to slow myself down. I need to unburden myself. That can be a really important recognition for that person, because that level of intensity of that reaction when someone says something to us is not just that situation, but the bigger picture of all the things we're carrying.
Yeah, absolutely, absolutely. I think, I mean, that's spot on, right? Is like we're kind of conditioned to have this story and live with this voice of, I have to, I have to, I have to. And that that comes that typically starts from somewhere, right? Either in
Mm-hmm.
a period where there was something disappointing that happened, or a period where you may have felt like you didn't live up to someone else's expectations, or maybe you felt guilty about something and it's just this internal turmoil of like, oh, that wasn't the best decision. But it's that story that we recreate and then turn into other stories. Like, for example, so I'm a mom of three boys, and what if one is very engaging and fired up, it doesn't mean that I'm a bad mother because of how I react. It doesn't mean I don't love any of them any less. It just means that interaction was stressful. And so I've come to really tell myself, I can say things, I can lose my temper just like anyone else, but I also have the power to correct that and apologize and try to repair that situation.
Mm-hmm.
But it also doesn't necessarily have to translate to the other people in the family. It doesn't mean that, I'm this horrible mother to my other children. It doesn't mean I'm a horrible wife to my husband. But if I allow myself to tell this story of like, you know, I'm worthless,
Mm-hmm.
I'm not a good mother, that doesn't lift me up at all, right? And then we kind of keep saying those things because in the moment you feel down and you feel defeated and you feel discouraged. And so that voice is very powerful. And if we allow that to ruminate, right, those neurotransmitters that created that voice get stronger. And so then the next time where you have an interaction, you're thinking worse thoughts, right? Like, I can't believe I did this again. I'm so worthless. Like, I shouldn't be a mother at all, right? I hate being a mom. That voice gets now really loud. And then
Yeah.
that translates the next time into like really deep thoughts, right? So if you think about it, all just started with one kind of silly thing, but it escalates pretty quickly when we sit in that negativity. So if you can kind of recognize, like, okay, this happened, I reacted, now let's sort of acknowledge what happened, reset, see if we can now flip something positive that we're telling ourselves. I can get really good at problem solving. I can get really good at dealing with confrontation. I can get really good at, saying I'm sorry. I can be someone who, is patient and kind. And that voice, right, is so different than the doom and gloom.
Yeah, the upward spiral rather than the downward spiral. And um, I think that's a really good point. We sort of create our future by giving us ourselves that beat, and deciding how do we want to handle this moment. And so I kind of have two more categories of questions for you. This is a little bit of a pivot, but we all know the specific autoimmune diseases, right? There's like MS, lupus, rheumatoid arthritis, several other ones. I think there's also probably, and correct me if I'm wrong, people who certainly don't meet any category of autoimmune illness, but there's something going wrong, whether it be related to stress response or something else. And then in the middle are these sort of things, I don't know if we call them syndromes or what, but like chronic fatigue, fibromyalgia, these things were sort of scoffed at 10 years ago. Like it's just depression, it's just neuroses. And now I think we're looking at them much more objectively as a physical process that's obviously, according to this chart, interacts with our mental health bidirectionally. But we have markers of them, inflammation measures, and things like that. Um, I guess I'd like your opinion on this sort of full spectrum of things. Are these sort of syndromes like CFS and fibromyalgia, are those their own distinct illnesses? Are they precursors to other diseases? Uh, and what are the ones that, there's something happening with our autoimmune wellness, but it probably doesn't fall in any category? I'm curious about your thoughts.
Yeah, I think all of the above. I think there are definitely things that we don't necessarily have a lab test to show what it is. So one thing
Mm-hmm.
that comes to mind is psoriatic arthritis. So patients who have psoriasis, or you might not have skin psoriasis, can develop a type of arthritis that we don't have a lab test to prove or to show you that that's what's happening. It's a clinical diagnosis. And so you can have a lot of these symptoms and be labeled as somebody with chronic fatigue or fibromyalgia and actually have a true legitimate diagnosis, but there's not a lab test that tells you that upfront. So you really do need a specialist to evaluate you and say, this seems a lot like this kind of diagnosis when we put the pieces together.
Mm-hmm.
So there is something tangible, definitely. There's also conditions that are more rare that not the full spectrum of specialties are aware of. Something that comes to mind right now that we're really evolving is gout, and the way that gout
Mm-hmm.
affects women, particularly, and the way that gout affects even men without having that typical swollen big toe all the time. So you can have gout as a syndrome where you have chronic pain and you get swelling and inflammation, but there's not always a perfect tool to tell you that that's what it is, because your blood uric acid level, where we rely on a blood test to help us understand that, is very fluid. It can go up and down, sideways, look normal, look abnormal at any given point in the day. So if you happen to
Mm-hmm.
have it checked at a time where your level is normal, your doctor may say, nope, you don't have it. Not where, I'm not going to put you on treatment. But deep down inside, you have a lot of inflammation from uric acid. There's also, kind of going back to the chart that we have shown, is the precursor things, right? Feeling tired and fatigued, when that doesn't get better or sort of compounds on itself, increases your cortisol level, which then increases the expression of inflammation chemicals, the cytokines, and chronic inflammation. We lead into this like chronic phase. And then
Mm-hmm.
your immune response becomes a little bit off kilter, and then you go on to potentially develop something that's more noticeable at some given time. So a lot of times when somebody will see a rheumatologist, they've gone to multiple different specialists and they're frustrated because they're like, nobody's finding anything. And then they finally come in and it's like, oh, well, this is what it is. Why did it take so long? Well, you went and checked a lot of boxes off in the work you've already done. But then also it's like process of elimination where we say, well, we didn't try to think about this. And maybe there's one other clue. Maybe there's something else that just popped up that seems kind of random or not associated, where it's like, no,
Mm-hmm.
this is actually a really big defining moment for this diagnosis. So I kind of think about that with Sjogren's. A lot of people in the autoimmune world believe that Sjogren's, there's not a great treatment for it. And they're probably right. We don't really have an amazing FDA approved treatment right now, but there's clinical trials being done. There's medications that are very close to being FDA approved for treating patients with Sjogren's. And so eventually we'll have a much better, hopefully, solution for people who have had this illness that has been very sort of pushed under the rug of like, well, you don't have lupus and you don't have rheumatoid arthritis. And, there's really nothing that we can do about it. I think there's a lot of,
Mm-hmm.
in
Mm-hmm.
medicine, there's a lot of like, well, there's nothing we can do about it. And I beg to differ. There's always some kind of something you can pull from your interaction with clients or patients that says, well, what if we just changed, again, one thing at a time? So even when you have an autoimmune diagnosis, let's say you are somebody with MS or lupus, right? And you're living in a state of constant stress, or you're really struggling navigating the complexity of managing your medication, right? This is so overwhelming. I have so many pills. I just don't know where to start. Again, it's taking that one single step to say, why does this feel overwhelming to me? What is it about the stigma of taking pills that I'm fighting so hard against? If these medications are meant to make me feel better, why do I resist the option that I might get better when I take them?
Mm.
So if we just try to target, like, what is it that we're resisting? What is it that we're fighting against, right? The tug of war, like, idea. What am I tugging on all day? And see, okay, what if I thought about this a little bit differently? Or what if I told myself every time I take a pill, I'm this much closer to being in remission or to feeling better or to being less fatigued? And again, it's that I kind of keep going back to it, but it's like that power of positivity. What if we tell ourselves each time I'm doing something, I'm helping myself be healthier and heal, and I'm allowing myself the opportunity that life will be better for me. And when we cross over that paradigm, things are less daunting and you're open, I find, to communication with your healthcare team, right? I'm trying the things you're suggesting and I'm not feeling like it's working. What are
Hmm.
my
Hmm.
other options? Instead
Hmm.
of when we go to an appointment and it's like, I think it's really easy to just be like, okay, your labs look really good. Here's your refill. Do you have any questions? Right. And the person's like, whoa, 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 what's happening?
Hmm.
What do you mean? Because I don't feel good. But if you don't pause and say, well, can you explain this to me? Because I'm not really feeling like I'm any different, or I'm not really feeling like this is making me better, but you're telling me I'm good. So why are we disconnected here? And I think in healthcare, there's still this sort of idea that the healthcare professional is somehow has this like ability to make us feel a certain way. But we don't know what your body feels like. We don't know what's going through your mind to know, I'm really struggling with 6 pills a day. Like, is there any way
Right.
that I could get the idea that by taking 6 pills a day, I'm sick? How can we change that? Well,
Hmm.
I can combine this and we could change this. And what about, adjusting this? Like, we can work through those things, right? But
Yeah.
we don't know that that's a thing unless somebody brings it up.
Yeah, yeah. I think that's a really good point. That feeling of powerlessness, or like, yeah, I have questions. I don't even know what the questions are. How do I start this, right? Or the authority that medical providers can have, whether or not they're aware that the patient feels that way when they walk in the room. And you brought up, we kind of started off talking about the lifestyle related sort of like low hanging fruit. Any individual could sort of do these things. And now you're talking more about medical treatments. And obviously, those are going to vary depending on the disorder or the symptoms. Um, and when we first discussed doing this interview, I sent you a list of like kind of an array of treatments that address certain things, inflammation or vascular symptoms, or uh, more directly affecting the immune system. um, I don't know if you have thoughts or things to share about this. I mean, one of the things that it makes me think about, for example, is if somebody has, uh, for example, Raynaud's related to their immune functioning, and they take a medication for that. Some of those cause sedation. So, sedation and fatigue, that's also one of the most common symptoms of autoimmune illnesses. And we can get in this sort of knot where there are 6 medications. Some of them are causing side effects that are a symptom already, and uh, untying that knot. What do we do? Are there things we should be focusing on? Are there? Yeah.
Yeah, that knot gets very, very messy. In rheumatology, I talk more about side effects of medication than I sometimes do of the actual diagnosis because of exactly what you're saying. Oftentimes it really takes that awareness of like, okay, remind me why you feel like I need this. Is this something that's optional, or is this something that's going to save my life or my organs. And when it comes down to that, we're trying to appease people because they're complaining of something. So it's like, well, here, you can have this, right? It's like a grocery store. You can have this, you can buy this.
Yeah. Yeah.
But is that really the best decision of what I want to do? Well, we don't always know. But I think too, and that's the importance of follow up, and why like close follow up when you're making adjustments and things is really important. Because if you make an adjustment and then say come back in 6 months, that makes it not, the perception of that is, well, this isn't important how I feel. Because if it takes that long, there a lot can happen in 6 months, right? I might move to another state and need another doctor. But if I say come back in 2 to 3 months, because I'm trying to pay attention to how this medication makes you feel, what does that tell the client or the patient? Okay, I need to pay attention to how this medication makes me feel, because my next visit is, we're going to talk about that. It's like having an agenda, right? Or like an assignment that's due. I need to come prepared to talk about that. So then when my patients come back and it's like, well, I don't really know that I feel any different. Okay, well, let's stop it. Because if you stop it and then you start to not feel good, you might realize, well, actually, maybe I
Yeah.
was feeling a little bit better. And I know sometimes that doesn't apply to, let's say, antidepressants or anti-anxiety meds. I'm not saying just stop medication, right? But
Right. Right.
I do think the frequent touches or touching base expresses, I'm invested in the way you're going to feel when I give this to you, but I need you to tell me what you're feeling like. And if you feel
Hmm.
worse, we need to address, okay, well, why might that be? Is it the medicine, or did you just have a major life event where we can kind of explain, okay, well, if you're getting 4 hours of sleep at night, I don't know that my med's responsible for your fatigue, but maybe my medication is responsible that you can't fall asleep, right? And so I do think there's a really big responsibility for healthcare professionals to own and know what it is you're expecting your drug or your prescription to do. If I prescribe something, I have to have an idea of the result I want that patient to have. And if I
Hmm.
don't, find somebody who can explain that to you. Like, you have the power to switch healthcare providers, because that is our main responsibility when we write a prescription, is to understand, are you having a side effect when I give this to you? Are you feeling better? Or are you having any abnormalities that I can't continue to use this? And so there's a lot of, well, here, take this. This should help you, right? How many times do we hear this should help you? But why should it help me? Looking
Hmm.
for.
Hmm.
I have
Hmm.
people, when I have patients, they're like, well, what should I expect? I'm like, oh my gosh, I'm so glad you asked me. I'm sorry that I forgot to tell you what you should expect. So it's that conversation, right? And if your healthcare person is in too much of a hurry to talk to you about your medication, a pharmacist is a good second resource. But I also, when we get into like complex medications and the way that medications interact with each other, things get a little bit tricky, because sometimes the water, so to speak, is very muddy. But we also do need to interact with pharmacists to help us understand, okay, this med should not be combined with this med, or this supplement really isn't ideal when you're being evaluated for XYZ. So it's really that team approach, and to not get offended when somebody says, like, if I have a patient call back and say, my pharmacist told me I shouldn't be on these two together. Oh my gosh, I'm
Hmm.
so glad they checked that. Here's an alternative that doesn't have that interaction. Instead of like, nope, I'm right.
Yeah.
Forget it then. Nothing. Don't take any of it, right? It's like, well, that didn't help anyone.
Sure. And with the unanswered questions that people who have these conditions, you know, that they live with, those they start seeking their own answers, and you see a lot of information about supplements that help. And while supplements, some of them may be relatively safe, that's not a guarantee. How they're produced by that specific company, how they interact, so the list of supplements that can be useful for these things is almost endless. But then you find, and I think kidney disease is on the rise because of people overdoing supplements. So really having that collaboration with the physician who can say, we're we're giving this medication to treat this specific uh, medical process that's happening, and these are the outcomes you should expect. Let's see if that's happening. And giving that 4 month window, I want to see how it's going. Also, I think it makes people feel cared for. Well, I really appreciate your time. I'm wondering if there's anything else that we haven't discussed that we should cover. And if not, I really appreciate everything we did cover.
Absolutely. Yeah, this was fun. I mean, the biggest kind of message that I would want people to get from this is really just that, healthcare in general, the way that your body feels and the way that you want your body to feel, you have a lot of power in that. And reclaiming that power for yourself is super important because I think we get really consumed in the should. I should feel like this. I should be more active. I should not be overweight. I should look a certain way. And when you really sit down to think about it, where is that voice coming from? And recognizing, is that me saying that about something that I want? Or is there really somebody that has power over me saying that? And why does that other person have that power? Because when we recognize, let's say, a parent, for example, right? Like once we're an adult, our parents' opinions, although they matter greatly, they're not living your life in your body.
Mm-hmm.
They're living their own life in their own body. And so, what essentially gives that person the power to control the way that you live your life on earth? And I think when you can recognize that the voice, right, the way we talk to ourselves, the way we talk to other people, the way we interact in the world is a reflection of the power we hold ourselves. And if you can have, again, maybe it's one thought a day to start with, where you can reframe that message from something that isn't working to something that feels better. That's a journey that you have control over to take. And I'm not saying that erases PTSD. I'm not saying it erases traumatic things or it erases generational trauma or, heritage. I know I'm saying this from a place where it sounds like, okay, yeah, that's nice in theory, right? But the reality is that what our future holds, what's happening to us now, or the way that we're controlling our behavior, our stress, the stimulus that we're willing to receive, is setting the stage for what's going to happen to us in the future. And so if we can alter that and lay a thicker foundation of something stronger that will serve us, it makes the other challenges in life a little bit easier to deal with. And if there's just, if there's one thing, it's just recognizing the more stress you have mentally, physically, the less your body is in balance. And that balance
Mm-hmm.
is so important because it leads to health issues. It leads to the inability to cope or to be sort of even keeled with, other human interactions. And so just recognizing like I have the ability to receive and to give back. And what happens with that is under my control. And I think a lot of times we lose the sight that, I'm living this life for myself and instead other people are telling me what I'm supposed to do and telling me how I should feel and what what medications I should be taking, and really questioning, if
Mm-hmm.
this doesn't seem right, it's okay to ask questions. It's okay to say, I don't really like how this makes me feel, but you thought it was important, so what might be an alternative to that? So I know that was a very tangential thought, but really coming back to like when I feel a certain way, right? Even recognizing, okay,
Mm-hmm.
when I
Mm-hmm.
feel happy, why do I feel happy? When I feel sad or depressed or down, why do I feel that way? Just being curious about that. Because if you can reflect, right, you can say, well, is this really the truth? Is this like totally, if I were to not wake up tomorrow, is that the thing that's the truth, right? And chances are there's something that could change.
So gaining that agency
Yeah.
is really a sort of a catalyst for opening up the door to because for some of these individuals, they really do feel, whether it's the mental health piece, feel hopeless or helpless or a lack of agency, or just they haven't gotten medical answers thus far. So finding that agency kind of opens that door. Yeah. Well, hey, I really, really appreciate your time and the information. I enjoyed hearing everything and learning. And again, this is Dr. Panico, Chief Rheumatologist at Summit. I'm interested in people's feedback and hope this is interesting or helps some folks out.
Yeah, thank you so much for having me.
Yeah, thank you.